Now, using our 3 steps, let's break this down. Cardiac pharmacology 13. This question's asking for incorrect teaching regarding the key problem, food to drug interactions, with the risk of warfarin blocking here. So before looking at the options, we're thinking warfarin is a blood thinner. The patient has a high risk for bleeding, and vitamin K blocks the effects of warfarin, which is the antidote. So we know vitamin K is found in those green leafy veggies here. So the memory trick we use to help you remember this is Warkin for warfarin. So just remember Warkin, so W for warfarin, it lasts a long time, like a war. So we have to do frequent lab checks, and so the patient needs to get their blood drawn a lot. Now Warkin, remember the K is for vitamin K, the antidote, found in those green leafy veggies. And then the last part of Warkin, IN for INR, which is a lab value to monitor, not PT, that's for heparin. So just remember Warkin. Now the solution we're looking for are incorrect statements. We're thinking high risk for bleeding here. So always remember, think what kills the patient first. And with any blood thinner, the patient can bleed out. So option number 1 is incorrect. Vitamin K can block warfarin's blood thinning effects, leading to more clots here. And option 2, also incorrect. The HCP should be made aware of any over-the-counter natural remedies. This could increase the risk for bleeding here. And option 3 is correct. Technically, kale is a green leafy, which is high in vitamin K that blocks the meds, leading to clots. So it's good to avoid these green leafy or excess amounts of green leafy. Not too high, not too low, just a nice even rate. Now option 4 is incorrect. Blood tests are required when you're on warfarin. Remember, warfarin lasts like a war a long time. So we need to do frequent blood checks. And option 5, wear closed-toed shoes. We're thinking risk for injury, increased risk for bleeding if the patient gets a wound. So remember, always ask yourself, what's the worst thing that can happen? And for this case, the patient bleeding out. So option 5, we have to choose. Okay, that wraps it up. Now using our 3 steps, let's break this down. This question's asking for which teaching for the key problem, simvastatin. So, before looking at the options, we're just thinking, what are statins here? Using the ending of the drug. So statins, we stay clean from cholesterol, or statins keep the vessels clean like a tin can for statin. And for the adverse side effects here, so we use the acronym STAT. S for sore muscles, T for a toxic liver, A for we avoid the grapefruit, which blocks absorption, and then T for we take statins at night. So the solution we're looking for are correct time to take this medication. So option number 1 is correct. Bedtime to take the medication is best. Remember, statin, the T for we take at night, or take before bedtime or even at dinner time. Technically, the liver works on fat overnight, so we want to block that liver from making this excess cholesterol here. Now, option 2, 3, and 4 are incorrect. Statins are not taken the AM before food, and option 3, guys, they're not taken the AM with food, they're taken at night. And option number 4 is also incorrect. Statins are not taken at lunch, they're taken at dinner time, or basically taken at night. So, really, before bed, at supper time, at dinner time, that is the time. Okay, that wraps it up. For more details, Now, using our 3 steps, let's break this down. This question's asking for which lab values for the key problem to monitor before giving the medication. So, this question gives you a lot of medications here. So let's break each one down one by one. And we're always thinking the worst possible case scenario here. So, methylprednisolone is a steroid, brand name Solumetrol. It's a steroid, so just think steroids increase the sugar and slow the WBCs, or basically slow immune response. Now, atenolol is an LOL ending drug. It's a beta blocker, which puts the brakes on the heart. So remember, the double L's for the double lows of the cardiac vitals, heart rate and blood pressure. And digoxin digs for that deep contraction. And remember, digoxin is a toxin. So we check blood levels, and low potassium, that hypokalemia, increases the patient risk for digoxin toxicity. Now, if you guys didn't know that, just write that down. It doesn't mean that digoxin causes low potassium. It just means that low potassium increases the risk for toxicity. And our last drug is tinzaparin. So remember, parin sounds like heparin. They're within the same family. So it's a blood thinner. So we check platelets and PTT, not the INR. That's for warfarin, INR. So the memory trick we use is HEPIT for heparin. We just call HEPIT the frog because heparin we check PTT with HEPIT. So the solution we're looking for are labs that can affect this patient from the meds they're taking. So option number 1 is correct. Digoxin levels are to be assessed because digoxin is a toxin. And option number 2, also correct. Blood glucose are checked when you're on steroids, since steroids increase the sugar. And option 3, this one was really tricky, but it's incorrect. So PT and INR are not affected by parins for tinzaparin. Guys, remember the memory trick. Warfarin for warfarin, we check the INR in warfarin. And HEPIT for heparin, we check the PTT. Now, option 4 and 5 are both correct because platelet count can be affected by heparin ending in parin, even enoxaparin. And option 5, also correct, potassium levels are checked since low potassium can make digoxin toxicity even worse here. So option 4 and 5 would be correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for the most important question to ask the patient on the key problem taking lisinopril with a massive high blood pressure, as well as cold symptoms. So remember, prils are ACE inhibitors that lower the blood pressure. So the memory trick we use is that prils are chilpril for the heart. So just remember, it lowers the blood pressure, not the heart rate. So the med is not working, apparently, because this patient has a really high blood pressure. So we're looking for assessment questions. What's causing the high blood pressure? Is the patient taking the medication correctly? And the question says that the patient has cold symptoms. So any type of over-the-counter cold remedies or medication has sodium, which swells the body, causing this increased blood pressure. So the solution we're looking for are questions to ask the patient to explore the cause of this hypertension. So option number 1 is correct. It assesses if the patient is taking over-the-counter cold medication. So over-the-counter cold medication again contains sodium, which swells the body, causing hypertension. So we avoid all over-the-counters, especially for the NCLEX. Now option 2, this one's very close, but it's incorrect. So stress at work or home relate to increased blood pressure, but it doesn't address the drug issue here. Now, option 3 is correct. We're assessing if the patient monitors their blood pressure. That'll help establish if the medicine is working or not. And option 4 and 5 are both incorrect. Exposure to an illness doesn't explain the blood pressure, and immunizations recently, again, doesn't really explain the blood pressure. Okay, that wraps it up. For more details